Welcome back to another edition of things influencers rave up and down all around town about, but then, oops, forgot to tell you this, that, and the other might just happen. In today's video, we're going to be talking about the negative effects one might encounter with dermaplaning. Everyone raves about dermaplaning, but are there things about it that could go wrong? Yes, there are. And in today's video, we are going to be talking about the lesser known, lesser mentioned, I might say, adverse side effects that one might encounter with dermaplaning, things that you want to be aware of before pursuing this, especially if you're thinking about doing it yourself at home. First of all, what is dermaplaning and why do people rave about it? Dermaplaning is a cosmetic procedure typically done by a trained professional where they take a surgical scalpel that is sterilized and they run it across the surface of the skin to remove the very top dead layer of the skin, as well as those little vellus hairs that we refer to as peach fuzz. People love dermaplaning because it has several benefits that make it something people keep going back to. Number one, it is a form of mechanical exfoliation. Number two, it removes those little vellus peach fuzz hairs. The benefits of doing that are that your skincare products absorb a little bit better because that top dead layer is kind of freshly cut and you get more even application, not only of your skincare products, but also makeup, right? If you ever try and put makeup over dry, rough skin texture, over a lot of peach fuzz, depending on the makeup product, it may break apart, get cakey, flaky. I'm no makeup artist, okay? You guys do not come here for Dr. Dray makeup tips, but this can definitely make a difference with how the makeup goes on, the smoothness, the evenness of the application. Plus, it just makes the skin look a little fresh, dewy, even, glowing, radiant. Who doesn't love that, right? So before you run out and buy a at-home dermaplaning, what might go wrong? Dermaplaning done by a trained professional, less likely to lead to adverse events in comparison to doing it at home. Nowadays, the market is flooded with at-home dermaplaning devices that kind of vary a lot. They're not necessarily a surgical scalpel, but rather some of them are essentially just a single blade razor. Probably the number one adverse event that you can encounter is an increase in skin sensitivity, irritation that might present with the symptoms of sensitivity, which are burning, stinging, redness. You also may experience a lot more discomfort when you put your skincare products on because they have better penetration. So some things may end up being more irritating to you. This is even more likely if improper technique is utilized, which is why having a trained professional do this is less likely to cause these issues for you. Now, the second major downside, which you really want to be careful with, is that it can end up triggering various skin breakouts. Of course, it can aggravate acne for sure because that heightened irritation brings in some inflammation that can drive more breakouts. And if you have richly melanated skin, you already know that inflammation, breakouts equals many months potentially, many months, a year potentially of stubborn dark spots that maybe you just recently faded. Like, okay, why do I have to deal with this again? So you might want to be aware of that if you have richly melanated skin, because that is very frustrating. That is very frustrating for sure. You also want to be really careful if you have acne, of course. Definitely don't pursue this if you have an active acne breakout. Significantly more likely to irritate, to inflame the skin, to aggravate the acne and lead to more breakouts. And again, not only hyperpigmentation in medium to deep skin tones, but also stubborn redness, the opposite of what you're hoping for when you do something that is exfoliating. In addition to acne breakouts, you also have to be mindful of the fact that you can potentially develop ingrown hairs, especially if your hair texture is more coiled. Ingrown hairs happen from facial shaving, or in this case can happen from dermaplaning. Basically, the cut hair grows back. Because of the curved nature, it grows downward. It has a sharp tip. It pierces the adjacent skin and starts to grow down into the skin outside of the follicle where it's not supposed to be. And that is called an ingrown ingrown hair. It is very annoying to deal with because it looks like a pimple. It can develop pus, and for people in particular who have richly melanated skin, who often, as a side note, have a more coiled hair texture that is more inclined to form ingrown hairs, well, now you have this breakout and you have hyperpigmentation, and it can be very uncomfortable, very painful. It's a challenge to deal with. Now, mind you, ingrown hairs are really common with any type of facial shaving, whether it be just traditional face shaving or this dermaplaning, which is not exactly the same because of the technique, but the same risk of ingrown hair. So the other risk is the risk of infection. The risk of infection is going to be even greater at home. What type of infection? Well, if you are dermaplaning around the mouth and around the nose, you do have a greater risk for the potential to develop impetigo, a staph infection that happens because a lot of us carry certain strains of staph bacteria in our nose, and they can end up popping up in areas where you have maybe a nick, a cut, compromised skin barrier integrity, and leading to impetigo. And the wart virus can lead to warts on the face, and they're kind of sneaky because sometimes they're flat warts on the face, and you might just think, oh, it's like some random little skin bump. You shave over it and you end up inoculating more wart virus in the surrounding skin, or you dermablade over it and you do the same thing. And the next thing you know, you have a bunch of these little flat warts, and they're kind of a pain to get rid of. They hang around for a long time. They will go away provided your immune system is healthy, but people who have immunosuppression as a result of underlying health problems or medications that they might be taking, those types of warts can be very stubborn and a challenge. So just another thing to be mindful of, like if you have a background of immunosuppression, maybe you are taking immunosuppressive medications to manage a condition, or you have an underlying health problem, probably want to be extra careful. You're at greater risk for infection and your skin is slower to heal. So those two things together make it so that maybe this is not the best thing for you to be doing, especially at home, where the risks of problems from poor technique are even greater. Something that not enough people talk about when they hype this up is that it's just simply not the best for all skin types, particularly if you have an underlying skin problem. If you have acne, if you have rosacea, if you have atopic dermatitis, or any type of facial eczema, you want to be extra cautious. Extra cautious. You don't ever want to do this over an active acne breakout for sure. If you have rosacea, be aware that the increase in sensitivity could aggravate your rosacea to the point where you're getting more flushing and ultimately more persistent stubborn redness. So definitely something to just keep in mind before following suit and doing this definitely at home yourself. I would also be extra cautious and resistant to jump on the bandwagon of at-home dermaplaning if you have richly melanated skin. I've already touched on this, but more inclined towards ingrown hairs, more inclined to stubborn hyperpigmentation. And another adverse event that can happen from nicks or from those ingrown hairs is the formation of keloids, which are more common in richly melanated skin types. As a matter of fact, a couple of weeks ago, I reacted to a video from a gal sharing that she developed pretty significant keloids around the jawline after the at-home facial shaving. If you go on her page, she describes how she developed keloid scarring after shaving her face. Keloid scars definitely can happen after shaving, especially if you develop ingrown hairs. In contrast to hypertrophic scars, which are also raised, keloid scars will continue to grow outside of the area of the initial skin injury, and they don't just go away on their own. If you know you have a tendency to make these, you have to be very careful with your skin and be really conservative with any sort of procedures that you choose to pursue. They frequently can develop after piercing. Treating keloids is not straightforward. They tend to come back. There are a variety of approaches, and usually more than one approach is needed to get the best results. Intralesional steroid medications to soften the scar. There are a variety of other things that might be injected, certain laser treatments to improve the appearance, and of course they can be excised with surgery, but of course when you excise them, there is a risk of another keloid forming in its place. And a strategy to reduce this risk is to apply continuous pressure to the area. So a lot of times, for example, if people have a keloid removed from their earlobe, they're advised to wear these pressure dressings on their lobes, but the pressure is thought to maybe perhaps suffocate some of the underlying processes that lead to keloid formation. And that's something that not enough people talk about, that whether it be dermaplaning or just shaving your face with a facial razor, you got to be careful if you're inclined to make keloids, especially if you're inclined to develop ingrown hairs, because that is a risk. And if you watch that YouTube short that I put up, you'll recall she ended up having to go on to have them surgically excised, which is very challenging because they often recur. I mean, it's a full-blown thing. Very, very, very unfortunate complication that I'm really glad that she was brave enough to share that with the internet, because people need to be aware that that's a potential adverse event that can happen, especially if you have very richly melanated skin. Now, at this point in the video, you might think, oh, she's totally against dermaplaning. And I'm not, especially when done by a trained professional. It's got advantages for sure. It's a form of exfoliation, which can definitely be beneficial for many people. And it does allow for better makeup application. So if you do this and it doesn't cause you any problems, great. Now, it will remove the peach fuzz and it will cut any terminal hairs that you have, but here's a myth. Any type of facial shaving, for that matter, it doesn't actually change how the hair grows back as far as the rate of hair growth, the thickness of the hair, or the hair color. This is a really popular myth, including, because I see this comment a lot, including in women who have PCOS. Women who have PCOS, they have hyperandrogenism and they can develop hirsutism, terminal hair growth. Shaving is not what causes that. So when you shave or you remove the hair with this technique, very similar, it's cutting the hair at a blunt angle. So as it grows back, you feel stubble. And as it grows back, you also are going to see that stubble. So it may be more obvious to your eyes than a longer terminal hair was. It may be more noticeable to have that little black dot there versus the longer hair that, you know, through light scattering, things like that, may not be as obvious en face when looking. But it doesn't actually make the hair turn to a pigmented terminal hair. It can't do that. So that's just a really popular myth out there that you guys need to be aware of. It won't actually alter the rate of hair growth. Now, you can develop, of course, ingrown hairs as a result of doing this, but it will not change how the hair grows moving forward. Be aware that you want to be really mindful with the aftercare. How you take care of your skin afterwards can make a difference. You want to be really gentle. You don't want to be using exfoliants or topical retinoids even that day. You might want to hold off on these things for a couple of days while the skin is a bit more sensitive. You also want to be really vigilant, of course, as you should always be, with good sun protection, especially if you have richly melanated skin, to reduce the risk of hyperpigmentation. And because after you have mechanically exfoliated, UV rays, they're going to get in a little bit more evenly and more efficiently because they don't have that mound, if you will, of dead debris there to surmount. So you do get a little bit even more enhanced UV penetration. So good sun protection, as always, is necessary, but here in particular. Who should avoid doing this? Anyone who has acne, especially if it's active, you're dealing with breakouts. Anyone who has an eczema, like atopic dermatitis. If you have deeply pigmented skin, you're inclined to form ingrown hairs and or keloids, I would stay away. I would be really cautious. If you're not sure if this is right for you, of course, always talk to your healthcare provider, chat with a professional who does this. But if you're considering doing this at home, also consider doing a little test spot to an area of the face and just seeing how your skin responds to it. All right, y'all. So dermaplaning can be excellent when done correctly, but it's not right for everyone. Let me know in the comments, have you ever done at-home dermaplaning? How did it go for you? Is it something that you swear up and down around, or did you have an adverse event related to doing it? If so, please share in the comments. I hope you enjoyed this video. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.